Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
A living donor kidney transplant usually involves a donated kidney from someone you know, like a family member, a friend, or a coworker. Genetically related family members are the ones most likely to be compatible living kidney donors. Now, both you and your living kidney donor are evaluated to determine if the donor's organ is a good match for you. And if you find out your living kidney donor isn't compatible with you, there is another option available, and that is called paired kidney donation.
In paired donation, your donor gives a kidney to someone else who is compatible. Then you receive a compatible kidney from that recipient's donor. And here to discuss paired kidney donation is Mayo Clinic nephrologist Dr. Carrie Shinstock and nurse Kay Cosberg, who helps to coordinate the paired kidney donation program across 3 sites at Mayo Clinic. And welcome both of you to the program.
Thank you.
Yeah, good to have both of you here. A wonderful topic that is certainly worth discussing. So there are a lot of kidneys going into people who need them, but there are also a lot of people out there who have 2 good kidneys, don't need one of them, and they're donating.
Yeah, that's right. We have a lot of donors who come forward, some out of the goodness of their heart, that know that there's a need for kidney donation. Those donors are called non-directed or altruistic donors. So those help really feed the paired donation program because they start something that's called a donor chain, which is kind of like a domino effect. They donate to the first recipient, and then that recipient's donor goes on to donate to the next recipient, and then on down the line. So that helps to benefit a lot of people getting transplanted.
Dr. Shinstock, how common is kidney transplant at Mayo Clinic, at any of the campus?
Well, it's getting larger. Last year we performed about 270 kidney transplants, and about 70% of those, 70 to 80%, were from a living donor. Mm-hmm. And last year, I think it was about 30% of our kidney transplants were through the kidney pair donation program. So it's a big deal. Across the 3 Mayo sites, we perform roughly 1,000 kidney transplants per year.
Are living kidney donors, are those kidneys better than deceased donor kidneys?
In general, yes. They tend to last longer, and they have improved function as compared to a deceased donor kidney transplant.
And why is that?
Well, I mean, for obvious reasons. I mean, you're getting there's not very much time between when the kidney is actually taken from the donor to when it's actually transplanted.
So less downtime.
Mm-hmm. Less downtime. That's a good way to explain it. The downtime is only 30 to 60 minutes at the most, whereas for a deceased donor it can be up to 24 hours. So that's a big reason. The other thing is that the donors in general, the living donors tend to be healthier when you look at them as a whole, but it is associated with improved long-term survival of that kidney.
True, because you can't just say, I want to donate and just walk in and don't. I mean, there are some protocols that you go through.
Right, and our kidney donors do come through a very extensive evaluation. It can be 2 days, 3 days, 4 days, for that evaluation. And it includes a lot of blood tests. It includes a lot of imaging. We need to see what their kidneys look like. Is there anything else going on in their bellies that we need to be aware of? Heart function studies, chest x-ray, and then meeting everyone on the team. They meet with a nephrologist, they meet with a surgeon, they meet with one of us nurse coordinators for education, social work. We also have a donor advocate that their role is specifically just to be that donor's spokesperson per se, to make sure that their wishes are heard, to the whole team. So it's a very big evaluation, a very thorough medical and psychosocial evaluation for these donors.
Do you ever fly a kidney from one Mayo institution to another? And how long does that take? You do?
Yeah, actually through the kidney pair donation program, we do it quite frequently. Kay could give you the numbers, but we also... So we have an internal KPD program with the other sites, and then we also participate with larger national kidney pair donation programs. So we ship a lot of kidneys to other institutions.
And likewise, we receive in kidneys, that were procured down at Mayo Jacksonville or Mayo Phoenix in Arizona. So we do that quite routinely. Last year we did, between the 3 sites, 77 of these paired kidney donations. And I'm, off the top of my head, probably 30 to 40% were shipped one way or another between. And we do use General Delta 101 to ship these kidneys. And so there's a lot of processes along the way, safety measures for these kidney donor organs that they get from point A to point B, and safety, and we make sure that they're accounted for each step of the way.
And you want to get on one of those airplanes because they make sure that they'll leave the gate and get to their destination on time, right? I mean, the pilots know the kidney's on there.
I don't know. I mean, we had one just recently where something was going on at the Minneapolis airport where they were delaying airplanes for like 2 hours, and we were trying to get a kidney on that plane, and someone spoke up and said, hey, we need to get this kidney from Minneapolis to X, and they actually bumped our kidney to a different plane that was actually leaving more on time. So that pilot may have known, but otherwise pilot probably doesn't know.
They probably shouldn't know.
And, yeah.
So I want to learn more about these altruistic donors. I mean, they are obviously unique individuals. Do they have anything in common?
I think just the history of being altruistic. Many are blood donors. Many are volunteers in their communities. They have just always been a giver, a helper. And, these people are very kind of salt of the earth. They're kind of normal people, and they just know that there's a need. They may have had a loved one 20 years ago that got a transplant, and now that they're older and maybe more set in their life and, work and financially, that now's the time, to do this, generous gift, to help someone else or many other people.
Someone they don't know.
Correct. And some may never meet, the person who got their kidney. It kind of is 50-50. Some donors really would like to at least get a name and an email to exchange a little information. Some donors are just, I know somebody got helped and that's why I did it. And, they're very, very amazing people. I've had the benefit to working with these people since 2001. I think we did our first non-directed donor, and I've worked with pretty much everyone along the way.
Do the recipients always want to meet the donor?
Not always. Okay. Not always.
No, not always. Everyone is a little bit different, but there are some that just can't wait to meet their donor or recipient. But you can imagine. Are you guys
ever there when that happens? I mean, it must be a pretty heart-wrenching event.
I haven't really been there when there's that initial meeting, but I have been part of instances where, they just have, I think prior to surgery, they kind of do some talking with their family members or something, and they kind of connect without really knowing, and that's really exciting.
Have the fact that you now have living donors, and it sounds like there are a fair number of those, has that taken the pressure off? Is the waiting list for a kidney transplant shorter than it used to be?
Unfortunately not. The kidney transplant list continues to grow. And unfortunately, in the last, I would say 5 years or so, the living donation rate has actually decreased. So, that's an unfortunate thing. But the waning times for kidneys, at least in our region, is, roughly 5 years. So getting a living donor kidney really helps these unfortunate end-stage renal disease patients.
All right, we're talking with Mayo Clinic nephrologist Dr. Carrie Shinstock and nurse coordinator Ms. Kay Kosberg about paired kidney donation. Time to take a short break. When we come back, we'll talk more about paired kidney donation. Plus, we'll talk more about the donor chain.
The chain. I need to figure that out. I got to get my pencil and paper ready for that. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We're talking about paired kidney donation with Mayo Clinic nephrologist Dr. Carrie Shinstock and nurse coordinator Ms. Kay Kosberg. Well, we've touched a little bit on paired kidney donation, and we've talked about the number that you've been doing and how successful it is and why a living kidney is better than a deceased donor's kidney. But tell us a little bit more specifically about how this paired kidney donation works.
Okay. Yeah, so the recipient comes forward, gets evaluated for transplant. They're proved to be a good candidate for transplant. Then they have people, loved ones, come in, to be their possible donors. So if the only possible donor for them is not compatible based on blood type or antibody issues, or maybe there's a big size or age mismatch, then we do talk to them specifically about the paired kidney program. So once the donor then gets approved, then we enter them into our database, and the magic of technology kind of mixes and matches and tries to find good donors to match, again, based on blood type, antibody issues, those kinds of things.
So you've got all this data, including blood type and antibodies and everything else, already in the computer. And then the computer would match these two up and say, here's a good match?
Mm-hmm.
Right. And then there's some fine tweaking, that Dr. Shinstock and I do, saying, even though it looks good on paper, we know this recipient has got very complex antibody issues that we need to look further into that.
So you do a lot of work to make sure that these two are compatible.
Correct, yeah. And if they do look compatible, then we would get a blood sample from the donor, send it in, and we'd actually mix in the lab, with that recipient's blood to make sure there are no antibody issues, because we don't want surprises, right before we go to surgery. We want to know all this way ahead of time, a couple weeks, a month, before we're going to surgery. Because a lot of our patients travel, quite a long ways to come to the Mayo Clinic, so.
I would say then, so we've got a couple of categories. We've got someone who needs a kidney donation but can't find a donor. Then there's someone who needs a kidney donation, has a family member or friend that wants to donate, but they're not a match.
Correct.
And then my friend James, his sister was a match, and off they went. So that's the kind of the third group, how it happens. Has it always been like that since kidney donations started? Was there always like, well, it didn't work for you, let's try a paired donation? Or did somebody get that idea after it had all started?
Yeah, kidney pair donation has only really been active for the last 10 years, to be honest. We have a really actually fairly large program in the United States where we've done about 380 kidney pair donations, but it used to just be, again, living donations started mainly with relatives, and then the idea of unrelated living donors became more popular. And again, in just the last 10 years have we done the paired donation. And when kidney pair donation started, it was mainly people who had a different blood type or they had a lot of antibodies. And that was really the only time it was done. But in the last, I would say, 5 years is when we have really integrated this idea of the compatible pair. So these are people who could, donor-recipient pairs who could just go to transplant. But they may say, hey, we could help somebody else, so we're going to go into this pool. Okay, so there's them. And then we've kind of learned that, hey, we can use this pool to help people in a lot of different ways. So now we match people on virus status. We match people, like she said, based on their age and different other factors. So now we're finding that we can not only access transplant for some recipients, but also try to improve the kidneys that these living donor recipients actually get. And that's really, really an exciting aspect that we're just learning about.
Despite the fact that you are really good at matching donor and recipient, you still have to give anti-rejection drugs to the recipient?
Yes.
And do you have to do less than you used to because you're better at matching?
I wish. That is, really a black box to personalize medicine and understand who needs more or less immunosuppression. And there's a lot of work being done on that issue. But unfortunately, we really don't know the answer. And most of the patients are on pretty similar immunosuppression regimens currently, although we have some ongoing research studies in that area.
But a living kidney from a living donor will live almost twice as long as a deceased donor kidney?
Well, not quite. We say that the half-life of a living donor kidney is about 12 to 14 years, meaning at about that time point, half of the living donor kidneys will still be functioning, whereas a deceased donor half-life is about 9 years. So
it is a lot better.
Yes, certainly.
Not
absolutely.
perfect yet, but.
Okay, Kay, if you can do this paired donation, I just am, it's taken me forever to figure out how the donor chain works. But now I'm starting to see, how do you not every day try to just beat your record for donor chains? That would just be like my driving force. Like
Maybe I do.
I know. Yeah, you have to. Explain a little bit about a donor chain.
So the donor chains really start with that altruistic donor, because that's the donor who steps forward and they're kind of a free donor.
Yeah, you don't, not a pair.
Right. So they don't have that recipient that we have to make sure that gets matched, along the way. So this is your free donor to start. So again, that donor would go to recipient A. That recipient A has got that donor who's not a match. So then donor A will go down to recipient B, and on down the line. So, and the beauty of these chains is you can kind of break them up. So you can space them out over a few days, a few weeks, a few months, because some donors, maybe it's a lot of husband and wives, will donate to each other. So maybe the wife wants to be the caregiver for the recipient or her husband. So he will get transplanted first. And then, she's the next donor in the chain. So she's like, can I wait like a week, to donate so I can kind of take care of him? And so then we can do that, because we always want to make sure, their loved one gets transplanted before they donate, or at least on the same day. So we can kind of spread these out. And again, we've have chains, that are 7 pairs long, 12 pairs long.
I've seen the photo.
Yeah.
It's very impactful.
Amazing.
And it's like you can't do 12 transplants or 12 donors all in the same day. We just don't have that many surgeons.
That's what I imagined. So now that makes more sense.
So that way we can spread this out, again, over several weeks or a couple months. And so that's given us a lot of luxury to really extend these chains. And like Dr. Shinstock was saying with the compatible pairs, you throw a couple extra O donors in there, or O blood type donors, and O blood type donors can donate to any blood type of the recipient. So they're kind of the gold ticket as well to make these chains work as well.
Okay, so the first thing we need to say is if you're a O blood, then you should maybe consider doing this. What else do you want potential donors, people that are just, I hear this and I think that is maybe something I could do. What do you want to say to them?
I would say that the actual donation process, you're going through a surgery that you don't need. But, people are only in the hospital for 1 to 2 days. They don't have to take any extra medicines. They don't really need much extra health care. And after the donation, after they've recovered from the surgery, they can go back to regular life. And to be honest, really, their incidence of developing kidney disease themselves is, very low. So,
and it does not affect your survival, your survival in life, right?
There's not any data to suggest that it affects their long-term, patient survival. No.
And you do this through the scope. There's not a big incision like there used to be.
Right, exactly.
It's a 2-inch incision to get the kidney out, and done with a scope and done.
Well,
Just like that.
I'm not a surgeon, so I can't say how, but it is that they're left with a very small scar.
And what would you say, Kay?
Well, and I think too, getting through the surgery, the recovery typically is pretty uncomplicated. But the donors who step forward, they need to be healthy. They don't have to be perfect, but they need to be healthy. And they need to be in a good place in their life. We really like to see the donor who's working, who has medical insurance, who has good support from their family or a close friend. And they've really thought about this. It's not just a whim. I saw this on Facebook and, this sounds like a good idea. So, we want them to really kind of think about it, really read up on, what does it mean to be a kidney donor? What, does my family know about this? And so we really want people to be in a good place, physically and psychosocially, to go through something like this.
Well, it is so great to hear about everything you're doing with regard to kidney transplant. Congratulations to you and your whole team. Paired kidney donation and the donor chain. We've been talking with Mayo Clinic nephrologist Dr. Carrie Shinstock and nurse coordinator Ms. Kay Cosberg. Thanks so much to both of you for being here.
Well, thank you.
Thank you.